When people ask me what narrative medicine is, I like to tell them that it's combining the art of storytelling with the science of medicine. It's where doctors and patients can both share their own experiences to learn about each other to facilitate a healing and understanding environment.
It is a way that people can relate to each other through transparency and telling stories.
The core of it is about providing a safe space for people to reflect on their experiences and share them and learn from other people's experiences as well.
It brings out the inner writer and inner storyteller of the patients and the doctors.
It is a very special thing that helps me understand humanitarian side of medicine.
It's about listening with compassion and listening radically to what others are saying.
So I use narrative medicine in my clinical practice in a number of ways. I've learned to be a better listener. I look at it as a two-way conversation, and by doing that, it creates a therapeutic relationship so that we are a team. I have also developed a tool called the 3-Minute Mental Makeover.
My now adult daughter was a patient of Dr. Tholey's when she was a teenager, and he asked if he could do a writing exercise with us called the 3-Minute Mental Makeover. So he asked us 3 things that we were grateful for, to write our life story in 6 words and 3 wishes. It was unlike any other doctor's appointment that we had ever been to.
I've actually sat down and did Dr. Tholey's 3-Minute Mental Makeover with some of my peers. Even though we knew each other before we did it, I feel like we had a different kind of relationship afterwards.
As a neonatologist, I work in the intensive care unit for babies, and I was taking care of a young baby who was on a heart-lung bypass machine. And the family was obviously very emotional, kind of distraught about things, understandably so. So I remember Dr. Tholey meeting with the parents, and the mom really gravitated towards the idea of being able to write down her thoughts. And towards the end of the first week that the baby was in the ICU, you can see a noticeable difference in sort of how she was interacting with the staff, with her husband, with the baby. Within several days, the baby was able to be taken off that machine as she was getting better, and eventually recovered fully and went home. And she continued to do that journaling, and she made mention of how that really helped her kind of cope with something that was completely unexpected.
After that appointment, Dr. Tholey invited Haley and I to attend a narrative medicine meeting, and we realized that there were people from all different areas of healthcare, doctors and nurses and people that were retired. They were just like this wonderful, kind, caring group of people.
When everyone comes together and presents some of their literary work, it's a great way for us to express our creativity and be vulnerable and connect with other like-minded individuals. That's what initially got me hooked onto narrative medicine and what made me fall in love with it.
I look forward to Tuesday mornings when we have our narrative medicine meetings because it just provides me energy.
I do like the looking forward to the session every 2 weeks. It gives me a nice break from just trying to practice medicine.
This way of practicing medicine is vital to the well-being of the patient, the well-being of the caregiver, and also the well-being of the doctor and the nurse and the clinician.
I think narrative medicine helps improve the patient experience by allowing us to communicate differently with patients. When we become 2 humans and not a doctor and a patient, the patients feel the difference.
A lot of times we have this hierarchy with the patients and the doctor where it feels like it's not on the same level. But if the doctor can go in and speak to them on an equal level and talk about their own concerns and be vulnerable, that gives the patient then, I believe, confidence to then lead to a better patient-doctor relationship.
Narrative medicine is a great tool to kind of establish framework to kind of share experiences with chronic illness. So then you can really establish that trustful bond that ultimately we're all looking for in a patient-provider relationship.
In narrative medicine, you saw all these individuals who were very vulnerable and talking about their feelings and talking about their emotions and talking about how they had these experiences with these patients. It can teach us to be compassionate and have empathy towards not just other patients, but other medical providers.
I'm proud of many features of the narrative medicine program. We have an affiliation with the Art Institute of Chicago, which has been a remarkable experience for us. Advocate has an affiliation with Maine Township High School with their school-based health center, and we have brought the 3-minute mental makeover to the high school.
A group of us from narrative medicine went in and introduced ourselves. The instructor guided them through the rest of the semester doing a 3-minute mental makeover at least once a week. The more the kids do this, the more they understand about themselves and that they understand that their peers experience a lot of the same things that they do.
I've had teachers approach me after the fact and say, I have not been able to get through to these students, and because you came, I'm able to learn more about them. They're able to learn about me.
I prioritize time to participate in narrative medicine because it feels good for my soul. It feels good to be heard and to hear.
Narrative medicine gave me the tools to be able to describe who they were as human beings to their caregivers. And I think in many ways it helped improve their care.
I've learned so much. It was so satisfying, the connection that I've been able to build with the other teammates that are part of this group. I wish that we could find a way to make narrative medicine more accessible to the general group of teammates or healthcare providers, because I think it's such a hidden gem.
I've always loved the phrase narrative medicine because to me, it is narrative as medicine, or stories can heal. That's the last thing I'd like to leave you with.